Okay, folks, we're joined by one of my favorite people in the world, Mike Lindell, the My Pillow guy. Welcome back, Mike. Great to see you. Also, a new friend, Andrew Whitney, Vice Chairman and Director of Phoenix Biotechnology. Welcome, gentlemen. Great to see you both. How are you?
Doing great. Thank you.
All right. Listen, I know you had a dust. Thank you so much. I know you had a dust up on CNN. I want to get to that later, if at all. Here's the important part. There's something called Oleandrin. It's a drug of some type that could be helpful to those with COVID. Mike, you teamed up with Andrew here, but Andrew, you're the subject matter expert, Vice Chair and Director of Phoenix Biotechnology. Please tell us what Oleandrin is, what it does, and how close are people to actually getting this thing?
Thanks very much, Greg. Terrific to be here. Well, first and foremost, we're here because we all want to heal the country, right? So this goes way above politics. We think we have something extremely compelling here, and we actually have the data to back that. Oleandrin is a tiny molecule found within a plant called oleander. And it is true that the oleander plant is a poisonous plant, but a lot of things in nature are poisonous, from alcohol to nutmeg. The way to think about the oleander plant is like a barrel of oil, crude oil. You can't run your car very safely or effectively on that. But if you have the knowledge and the skills and you can extract a tiny fraction from within that, gasoline in the case of a barrel of crude, you can run your car on it. Oleandrin is a tiny molecule within that plant. And this company has studied it for more than 25 years with the world's leading subject matter experts on that molecule. I can tell you that it is very safe and it is very effective. We've already taken it through the FDA's phase 1 and phase 2 clinical trials to establish safety in humans beyond any doubt. That's all published information. And we also now know it's highly effective in tackling COVID-19. We have that in terms of lab-based data and also anecdotal data that's very compelling in humans that's already with the FDA.
These tests, these phase 1 and phase 2 tests are on file with the National Institute of Health. How many more tests does it have to go? And I'll go to you in a second, Mike. How many more tests until people can access it?
Two answers to that, Greg. First of all, if the FDA gave us a thing called an IND number or an emergency use authorization, we could start running formal hospital tests immediately. The alternative route to go is to take it out there as a dietary supplement, and we can give people access to it tomorrow.
Okay, excellent. So you called up Mike Lindell at some point. Mike, obviously you're tight with the president. I understand you engaged Dr. Carson, head of HUD, world-class physician, brain surgeon. Excitement about this. What are you trying to do? You're trying to get the attention of the FDA, trying to kind of grease the wheels here a little bit?
Well, when Andrew reached out to me on Easter and he told me that he had this cure, and I'm a collection center. Everyone's calling me after the speech at the Rose Garden, whether it's sanitizers and all these different things, and anything I get that I feel is good, I turn it into the task force, which Dr. Ben Carson is on the task force, and I gave him this right away because it just sounded so compelling, and all the safety tests were done when I talked to Andrew for hours, and he sent data to me and showed me, and then I gave it to Secretary Carson, and he looked at it and he says, "Wow, this is amazing," and we kept at it, and we kept the company had turned everything into the FDA, and it was very exciting. I'm thinking, wow, we're going to have the country back open in a month, and a month led to 2 months, and they're waiting to hear back from the FDA. Well, then they came to me just as a consultant with my being able to scale things. As we're getting close here and hoping the FDA releases it, we got to have enough. They put me on the board of the company. I was honored to be on the board and be able to scale this to the masses as soon as they approve it.
As soon as they approve it. And Andrew, they will only approve it when it's approvable, when they are ready. You do need FDA approval, and when they approve it, you're in business, and potentially we're in business, but nothing happens until then, correct?
That is technically correct, Greg. Yes, we have, like I said before, we've already got phase 1 and phase 2 clinical trial safety done on this because we developed it for a cancer application a number of years ago. So we already know it's safe in humans. All we're asking for is the opportunity to test it in a formal hospital environment so that we can demonstrate in that kind of environment what we already know, having already tested this. We know it's effective. We have compelling data. The FDA now has that. And, we would like to formalize those tests and get this out there to people.
Well, I know Anderson Cooper jumped down your throat the other night, Mike. I'm sorry that happened. I mean, it sounds like you guys have all the right intentions and you're talking to the right people, and this could potentially help people in the end. Anderson is a nice guy in real life. I've met him, but everybody over at CNN, they're just trying to generate all these viral moments and, you know, make a spectacle.
Well, he wouldn't let me talk. And one of the things I wanted to tell him is, you know, it was since when I found out it was safe, I started using it myself and giving it to friends and family that tested positive.
Oh, wait a second.
And it was amazing.
Mike,
amazing
wait, Andrew,
results.
hold on. Andrew, is he allowed to do that?
Well, I'm doing it as well, and so is everybody else at the company, because we believe in the product, Greg. We know it works, but the bottom line is, what would be wrong with just letting us test it in a hospital environment? Give us the opportunity. There's nothing to lose. We already know it's safe in humans because we've already gone through FDA phase 1 and 2 tests in humans.
Right.
Same compound. So there's no downside to this, and we have very compelling data that shows this is tremendously effective.
Good luck, gentlemen. Thank you very much. For more information, please go to Phoenix Biotechnology. Great website. Andrew and Mike, stay in touch.